Hello, my name is Dr. Scott Olson, and I'm Assistant Clinical Professor of Radiology and Neurosciences at UCSD Medical Center. With all that's happened with Bret Michaels recently, I've had a lot of questions about subarachnoid hemorrhage. Subarachnoid hemorrhage occurs in about 10 in 100,000 people. The most common cause is trauma. In non-traumatic subarachnoid hemorrhage, the most common cause is a ruptured brain aneurysm. And then there's some other things that are less common, such as arteriovenous malformations within the brain. Drug use with particularly cocaine can cause that. But in 15 to 20% of the time, as was the case with Bret Michaels, a cause is never found. In fact, that is actually an excellent prognostic indicator if they don't find the source of the bleeding. Brain aneurysms are fairly common. They occur in 1 to 3% of the population. Regarding the risk to rupture, though, there are some factors that we know, such as the location of the brain aneurysm or the size of it, that make it more likely to rupture. If an aneurysm ruptures, about 10 to 15% of people will die before they make it to the hospital, and about 50% of people will die within 2 weeks. Of the survivors, almost half of them will have some residual disability. The symptoms of an aneurysmal subarachnoid hemorrhage are predominantly the sudden onset of a very severe headache. It's different than the usual headaches which you may suffer in that it becomes maximally intense within a few seconds. There's also associated nausea and vomiting oftentimes. A loss of consciousness is fairly common due to either increased pressure or damage to the brain. Sometimes an aneurysm can press on a nerve, causing an eye to close, or the eye to lock in place, causing double vision. If the aneurysm ruptures and the blood goes into the brain, it can cause numbness or weakness or speech difficulty. And there are a couple of treatment options when an aneurysm has ruptured. The one is an endovascular procedure where we use image guidance and go with a catheter into the artery in the leg, and using wires navigate the catheter into the aneurysm, then we fill it up with platinum coils. The other treatment and option is for an open surgical clipping, where a surgeon makes an incision in the scalp, temporarily removes part of the skull, and then places a surgical clip across the aneurysm to prevent it from re-rupturing. The goal of treatments is to prevent an aneurysm from re-rupturing. It's not going to improve the clinical condition of the patient that suffered an aneurysmal subarachnoid hemorrhage.